Hello, everyone. My name is Dr. McAllister Castellas. For those of you who have not met me, I am a general dentist and I am finishing a master's degree in dental public health at the University of Iowa. I previously had experience in full-time practice in federally qualified health centers in both Virginia and Wisconsin. I've recently been working with Virginia Health Catalyst as their clinical consultant on several projects, including this specific one on ICD-10 codes and implementing dental diagnostic codes in the Safety Net program in Virginia. Just wanted to take a few minutes to review this program with all of you all and share this presentation that we had the opportunity to present earlier in April at the National Oral Health Conference in St. Louis. I'm just going to minimize myself right up here and we'll get going. So as I go through this presentation, there are three things I want you to take away with this. One, we're going to talk about the 5-phase plan that begins with the readiness assessment and concludes in a continuation of this project regarding ICD-10 diagnostic code implementation in the dental safety net clinic setting. We'll describe a model that utilizes CDT procedure codes, dental procedure codes, along with ICD-10 diagnostic codes to link procedures and diagnoses to better improve medical dental integration and inform our stakeholders regarding community health status. And finally, we'll examine 2 pilot programs that aim to inform the framework for a value-based care system in Virginia. This work is funded through some funds from the American Rescue Plan Act from the Virginia Department of Health, as well as by the CareQuest Institute. So value-based care systems utilize a reimbursement method that ties payments to clinicians based on the quality of the care delivered in regard to its effectiveness and efficiency. One way to measure the effectiveness and efficiency of care delivery includes utilization of diagnostic codes. Diagnostic codes help provide insight regarding risk adjustment for patient populations, track changes regarding chronic conditions over time, and provide insight into the resource allocation for specific patients. So why some patients may require more resources or treatments compared to others, and can provide insight regarding the appropriateness of the dental procedure that was performed. Our traditional reimbursement models in dental follow what is called a fee-for-service model, where a clinician is paid based on the service provided. There's no requirement to demonstrate improved patient health outcomes, cost savings for the clinic, or a positive care experience for the patient or the clinic care team. In a value-based care system, there is a requirement for tracking and reporting of these measures, looking at measures regarding improved health outcomes and cost savings, and will provide a more complete insight regarding community health status and opportunities for improvement within the system. Over the next 12 months, 2 dental safety net clinics have worked alongside Catalyst staff to operationalize best practices, evaluate success, and create a replicable model for Virginia's safety net clinics. So we're about 12 months into that 24-month period right now. Participants receive high-touch technical assistance and education, as well as necessary resources to effectively design and implement clinic-specific programs that will meet the needs of their patients and the families that it serves. Team members also exchange ideas with other clinic teams working towards these same goals. The funding supports this essential work that pushes Virginia towards a more equitable, person-centered, and value-based oral health care system. The ICD-10 project involves taking a look at the development and implementation of a model that utilizes CDT dental procedure codes, CPT medical procedure codes, and ICD-10 diagnostic codes to link diagnoses in the procedures that they are link diagnoses to the procedures that they are performed for. Doing this allows us to give better insight regarding why a procedure was done, the types and trends and health conditions in our community, success of treatment, and a general idea of overall population health and trends. Determining how these codes can contribute to the integration for individuals with chronic disease and multidisciplinary care management of these chronic conditions, and then also propel our community health centers towards a more value-based care and value-based payment system. This project aims to take elements of a value-based care system and utilize the quadruple aim approach that will promote a more comprehensive, interprofessional, collaborative healthcare system within the dental safety net of Virginia. As these projects were designed by participating clinics, it was important that we included team members from the dental team, the medical team, behavioral health team, IT systems, billing and scheduling, and other administrative positions. Ultimately, this equitable, inclusive care system must be efficient and cost effective while supporting positive outcomes for the patients, as well as a positive care experience for the care teams as well as their patients. Incorporation of ICD-10 codes not only provides a more complete understanding of health status of a community, but better promotes a shared language within the EHR, promoting enhanced interoperability. Once the two dental safety nets were provided, this project timeline kind of gives you an idea of where we have been and where we're going next. So once the two safety net clinics were identified, each clinic identified relevant team members from both their direct care teams as well as their administrative and IT support. These teams completed individual as well as team readiness assessments, which we used to inform education and training modules for our phase two. Training and education were completed both as large groups every month with one-on-one meetings during the off months, where clinics could meet with the Catalyst team for additional support or guidance. Each clinic took a different approach to identify their target population in phase three, and once that population was identified, existing process maps and workflows were adjusted to incorporate selected ICD-10 codes relevant for their project. We are now entering our implementation phase, and clinics are beginning to pilot these new workflows and will be completing monthly quality reports as well as PDSA cycles as needed to improve their systems. Ultimately, as these clinics transition into phase five, we will continue to provide technical support and guidance as these processes are improved and sustainable systems are established. And these clinics will continue to move towards scaling upward to include additional patients and ICD-10 codes as appropriate. So here we are, we're right about here in phase four. These were the results from our readiness assessment of phase one. As it can be seen with Clinic A, there is minimal familiarity with elements of this project, both in the medical as well as the dental teams. Clinic Team B did demonstrate an extreme familiarity with several elements, such as the quadruple aim and this concept of coding. Due to the time constraints, I don't have the results for the individual assessments in this presentation, but they do provide some insight regarding readiness of these individuals in administrative roles at the clinics, as well as our clinic care teams. So we're able to inform based on all participating team members as we develop our education. Over the course of the year, these clinics participated in group and one-on-one education and training sessions. So these included things like related to our project planning and evaluation and being able to understand and discuss the initiative overview and who was on the team and expectations for each of those roles. We worked with our teams to understand and discuss how to write an aim statement and modify their workflows as needed. We reviewed anticipated qualitative and quantitative information that would be collected during the project and how to utilize PDSA cycles for program evaluation. Ultimately, again, this project context is placed in this concept of value-based care, utilizing the triple aim and quadruple aim, and be able to introduce IDC-10 codes and its role in dentistry, and how this relates to our quality measures and utilization of patient registries to track outcomes. As we administered our year one assessment, we are now in the process of analyzing the results to examine the impact of these group and one-on-one educational and training sessions we have completed. So as I mentioned, implementation has begun. Clinic A is targeting hypertensive patients, while Clinic B is targeting uncontrolled diabetics. As they've chosen different patient populations, they will also be utilizing different ICD-10 codes as they get introduced into each clinic. Teams will be providing monthly quality reports to us, and these reports will include information regarding clinician experience, as well as patient care experiences, as well as code utilization and care coordination and timeliness. These clinics will be undergoing continual evaluation and improvement utilizing PDSA cycles, and we will ultimately have an opportunity for some shared reporting to our community stakeholders with these lessons learned. At this time, I do want to share that we do have some lessons learned already from our phase one and phase two, and that highlighting early buy-in and collaborative conversation and flexibility is important to long-term success. So establishing a collaborative rapport across the dental, medical, IT, and administrative champions within the clinic teams early on better supports the planning for these projects. We did notice that when staffing shortages and turnover happen, this can interrupt the planning process, so having flexibility is very important to remain on track, on task. We did find that when we provided opportunities for breakout sessions during our group calls for clinic team members in similar roles, to be able to get together, this helps support cross-team learning and collaboration. Thank you all for your time. Here's my contact information as well as Erica's. And if you have any questions, please do not hesitate to reach out to us. And we're really excited to continue to share the next steps of this project. Thank you so much.